So good evening, everyone. So we'll continue for where we are left in the last day. So hope you have understood what we have been discussing yesterday, and hope all you have received the link for yesterday's recording in your email IDs. So if anyone have not received, please connect with me for your recordings. If you have not received, you can connect me with my phone or WhatsApp. Okay. So we have yesterday, actually, we were discussing about how the kind of factors we need to consider while we are actually treating a particular patient, and how the case reporting is going to be influenced by by looking into those factors while we're treating a particular patient. So let me share my screen. We'll start from where we are left. Okay, so yesterday's last slide was about the factors which affects the vitality and how it is different from that of a modern medicine perspective, and how we look into what are the things affect the body health status. So from a modern medical concepts, we have seen about how it is single centric in terms of either a diet or an infection or some stress or some receptors is basically involved in creating a particular disease. And the similar thing we have seen from our perspective also, how the different components of our health, day-to-day life, the health aspects of day-to-day life has an impact on how we fall healthy or how we fall into disease state. This is what we have seen about yesterday. So whenever we are treating a patient, whenever we are looking into a patient's particular status or planning to prescribe some sort of treatment for that particular patients, we need to basically understand like how is the vitality status of that particular patient. So in order to understand what is the vitality, I'm very sure that yesterday you might have just thought about what is vitality, and we have not discussed enough about what is vitality yesterday. So we will just describe a brief about vitality, and every time it is a very confusing concepts, like from our college days, like about defining vitality. It was more versed in our case, like at that point of time, we did not have enough kind of webinars or enough kind of evidence or kind of evidence-based teaching, which is being carried out today in most of the medical colleges to understand what is vitality. So we always thought in that day, vitality could be something related to immunity. Vitality could be something related to the body's health status, or similar thing like a prana. We don't know what is prana, but we still say that prana is the energy which is being controlled during yoga. So I have just checked some contemporary evidence for what is vitality. So vitality is not being only discussed by we naturopaths. Vitality is always been a concept of psychology, where they have been discussing about this vital force among the people. So if you look into vitality as a philosophical concept, and definitely vitality is a philosophical concept also, and philosophy is not a very bad term for the scientific basis. Okay, so whenever we discuss about science or scientific basis of anything, we always ignore the philosophical component of that particular stuff. So without philosophy, there is no science. Okay, everything has a philosophy behind it, and if you are not considering philosophy while we are planning or while we are making the treatment prescription for a particular patient, our treatment will be just a reductionist treatment, and it will not reach the root cause of that particular patients, which we have been discussing yesterday, right? So philosophy, basically how it is like, when you see vitality is an animating force perceived to emanate from the self. Look, it is something like everyone has certain sort of vitality, and that vitality is something which emanates from the oneself, like which influence the psychological well-being. Just 1 minute, give me a minute. Okay, so now if you see vitality, when you have all the somatic functions, how you behave, how you react to a particular situations, everything in a particular given scenario, it is influenced by this vitality. It is a kind of a aliveness or kind of an energy which is present inside the body, which is not exactly the physical or the psychological health. Like when you see like aliveness or the positive energy. Do not consider that something which is related to exclusively related to psychology, or something which is exclusively related to physical health. So the subjective aliveness is something which we cannot quantify by means of any scales. Like we cannot have anxiety scale, or we cannot have a depression scale to find that how much is subjectively you are feeling alive. So this is the component which we need to check in every person, irrespective of whatever is the disease condition they are being in. Let it be a cancer, let it be a diabetes, let it be common fever, COVID-19, irrespective of whatever the state of affair that particular person is in, this is something which we need to check in a particular person. And also, this is something where we always call it as a coping mechanism. Like we all reacted to COVID-19 in a very different way, right? Like most of us. So we have around 162 people over here now. We all reacted to COVID-19 in a different way. And we all react to every given situation in very different ways, based on the kind of coping mechanism we have inside our body. If you get a fever, many of us will be scared. Many of us will be wanting to defend it immediately. Some of us want to wait and see what is happening and then defend it in a way it is appropriate to defend. So it depends upon what is the kind of adaptation statistics or strategies we have in our mind and in our hand. Okay, so this reservoir of adaptation energy is regarded as a principal factor for resilience. So resilience is the important component which you would be requiring for a person, if at all you want to cope up and come from something. So whenever we see different kind of people, whenever see different kinds of patients recovering from different diseases, we wonder that what happens to this particular patient. We are giving the same treatment, we are giving them with the same enthusiasm, we are giving with the same energy. The doctor is not changing, you yourself is the doctor, only the patient is changing from each other. Some of the patients are getting very good results, some of the patients are not getting the results at all. So they'll be blaming you. They'll be like, you'll be getting appreciation from many of the people, and there will be people who are saying that nothing works. Naturopathy does not work on me. I've done everything right and nothing is working on me. So this is basically because of that adaptation energy and the kind of resilience, the kind of concepts about a particular disease. Whenever you say a person that you have diabetes, what is the kind of change happens in that particular person's mind is something which we need to capture. If at all we want to successfully negate his condition and bring the much needed change in that particular person, that your treatment, if it wants to work in the way it has to work, we need to adapt and find what is the kind of resilience capacity or the kind of aliveness or the energy which is available in that particular person. Based on classifying this vitality, based on how the patient is behaving in terms of whatever capacity he is having, how much our adaptation energy he is having, that depends upon how much we are able to treat that particular person. So whenever a patient come in front of us, we can stage the disease based on the vitality and the toxemia status and the symptoms, what is presenting. And this is exactly what you see in your iris also. Iris, yesterday, as I told, iris does not give names for a disease, but definitely gives what is a state of affair which is there inside your body. So whenever you take any acute conditions, okay, which is having visible symptoms, there are discharges, there are pus formation and things like that, which you're seeing in front of the person. There is actually a toxic discharge which is happening. So the body is not blocking anything, everything is pushed out. At that point of time, even though it is a kind of a temporarily weak vitality, if the person's resilience capacity is very, very high, the discharge continue to happen. And if at all we are suppressing it somewhere over there, it gets into the subacute stage where there will be a lowered activity. At that point of time, you do not feel any visible changes happening in the body. There is no redness, no swelling, no fever. And or like, for example, if you take diabetes, so you feel polydipsia, polyuria and all those stuff, you feel excess sweating, some foul smell and all. But it is not completely affecting your body during the first initial stages of diabetes. So here the vitality is varying from good and bad, and the toxin is getting absorbed into your different organs. Maybe it in your liver, maybe it in your adipose tissues, maybe it in the different parts of your body, it is getting absorbed. You will be feeling something is not right, but you're not able to see anything visibly. So this is the stage where the toxins get started absorbing. And this is what you need to basically understand. The second line over here is very, very important. Whenever we get a patient irrespective of whatever the disease the patient is having. We can treat almost all the conditions in the world. Only thing, if you believe and stick to your basics. That is the basics of toxemia. An organ or a tissue does not function properly until unless the toxemia is relieved from that particular organ. And in every condition, almost all the eliminatory organs are affected. And we need to correct that particular thing. If it is in the acute stage, we need to support the eliminatory organs to eliminate it completely and bring back to solace. And in subacute stage, we need to induce elimination and clean the debris from that particular organism. When it gets to chronic, you will start getting persistent symptoms. It is not like that inflammatory symptoms which you started getting initially. It will be something which is going to be persisting, which is going to be, there is a lot of reactions in the body, there will be poor vitality, you're susceptible to many different kinds of conditions. So this is a gradual change which is happening in our patients. Finally, what stage will be a degenerative stage, where will be no toxic discharge will be happening. The body is not able to push things out. Irrespective of your condition, you can fit any disease into this particular scale which is given over here. Be it diabetes, be it diarrhea, be it typhoid, you can fix those into this particular thing. And naturopathy, as a naturopath, you should not look for just on the biological reason for a disease. Diabetes is not at all about insulin resistance or not at all about your blood sugar level. And if you hypertension is not just about your blood pressure, or it's not just giving some medications or reducing your blood pressure or giving some natural remedies and reducing your blood pressure. We need to look into the constant degenerative changes. So this is a very basic physiology which we have studied from the first year onwards in our colleges. Whenever we are stressed, for any type of stress, okay, what is the first thing which happens in our body? Can anyone give an answer? What is that happens inside our body in terms of like whenever we are stressed? You're worried about what happens with BNYs, like after passing BNYs, what will happen to you? Okay, innervation. I just want to, okay, stress hormones are released. There is nervous tension, disturbances of homeostasis, anger, frustration, normal function disturbed. Okay, these all are things which is happening outside. There is cortisol increase again. Okay, so adrenaline rush happens, the breathing changes, the heartbeat increases. Yes, the fight or flight mechanism is what I just wanted to just initially start. So the fight or flight mechanism is something which starts immediately when you are stressed. Okay, and all these things, other whatever you have told, cellular modification, heart rate, cortisol release, and all those things happens as a reaction to your flight or fight mechanism. So okay, if the flight or fight mechanism exists in a person for a longer period of time, whatever treatments we are going to give, it is not going to impact that person's root cause, like impact that person's health, because there is a low grade, like inflammation is supposed to be a short-term adaptive reaction. But if this inflammation is going to continue for a long time, and inflammation is affected by anything, like where is the brain in our body? Where is the brain located in our body? It's a very common question. What do you think? Where is the brain? Okay, skull, cell membrane, skull, cranial cavity, cranium. Brain is there in all parts of our body. Okay, in your gut, in your feet, in your finger, in every cell we have the brain. That is why the perception, what you see, the brain is reacting. If you're putting your legs on something, your brain is reacting. Brain is there everywhere. The nervous system is spread across the body, and that is connected to your brain. So brain is about everywhere in the body. The brain, I'm not talking about mind. Nerves is an extension of your brain, which is there everywhere, and nerves react to the things. And the reaction in the nerves starts with what you perceive in front of your body. And mind and brain is not a kind of a separate thing. It is like everything is starting from your hypothalamus stimulation, and you are getting all those chain reactions in front of our body. So whenever we look into anything, until and unless you correct the flight or fight mechanism in a person, which is continuously happening in a particular person, there is not going to be any change in that particular person. And we need to get into that kind of small, minute area where we can treat a particular patient from the root cause. If at all we are planning to make a real change in our patients, if at all we want to just be the superficial physician we are, there is not necessary to get into all these particular things. And if you see, as a naturopath, we need to understand the concepts of healing in a particular person. There are certain laws of healing. The healing begins on the inside of the vital organs first, from the most important organs to the least important organs. The outer surfaces are healed at the last. So whenever you get a psoriasis patient, for example, or an eczema patient, for example, if you are continuously applying mud, continuously applying turmeric and things to the skin, it may get some temporary relief, but it is not going to relieve the entire condition immediately. If the skin is infected, it is not the skin which you need to treat first, it is the lungs which we need to treat first. The lungs, the gut, the kidneys, and your skin. Alone, aggressively approaching on the skin will not be working in that way. So the internal organs are first healed, and then it will be coming the outer organs. Healing begins from the middle of the body, then out to the extremities. It is not from inside to outside to inside. It is from the center towards the sides. Healing begins from the top and goes towards the down of the body. And retracing healing begins on the most recent problems back to the original problem. So you will be initially reducing your pain, then slowly every one steps, it will be going back and you will be reaching the original problems. And that original problem is something which we need to address. During healing, when the healing takes place in a particular person, the person will re-experience any prior illness where the vital force was inappropriately treated. He'll be experiencing everything. This is what healing crisis. Like whenever we put some patients into fasting, they experience all the sort of problems. They get vomiting, they get diarrheas, they get redness of the skin, they get a lot of itching, the urine stops in certain patients, there will be constipation in certain patients. These all are kind of healing crisis. The patient will be re-experiencing all the symptoms which we have gone through in a particular condition. And this you will be understanding only when you experience or when you see this particular thing happening in front of your eyes. So we need to prepare our patients to go through all these particular things when the patient is coming to us. And you see, like many a times I have seen that if you see the non-institutionally qualified naturopaths, they are very confident in treating a particular patient. They are very much like, they are very strong in terms of telling the patients, you need to do this if you want to be well. But we are kind of adjusting everything. So if you do not want to do this, you can do this as well. So we have multiple options which we present in front of our patient. You are here to make a change. You are here to make a change or impact in the person's life where the person will become independent of the doctors. The person will not be just depending upon you for his or her health. That is what you basically try and do in a particular person. So at that point of time, what you need to do is like, we need to be very strongly convicted in what we are trying to teach that particular person. So then coming to the holism. So though we call ourselves as a holistic system of medicine, our case reporting or our consultations does not reflect the same thing, right? I don't think so. Like our case reporting, ultimately we just end up in writing the modern diagnosis and trying and treating those symptoms which is present in that particular person. So the holism principle has three main concepts of beliefs. Okay. First, it is too important to consider an organism as a whole. So this we read and we never do this. This is not something which new I am saying. The best way to study the behavior of a complex system is to treat it as a whole and not merely to analyze the structure and behavior of its component parts. You don't have to just look into how your mind is doing. You don't have to look into how your brain is functioning, your stomach is functioning, your muscles are functioning. If you are isolating and treating, you are very good in physiotherapy, you are very good in acupuncture, you are very good in nutrition, very good in yoga. It is again an isolated method. So yoga, naturopathy, all the systems, which is a holistic approach, where if you want to understand the behavior of a complex system, we need to look at it as a whole. Do not go for shortcuts. If you go for shortcuts, definitely you will earn money as a doctor for sure, but you won't be earning it for the lifetime. So whatever you may be earning, 20,000, 30,000, 40,000, 50,000, 1 lakh, 2 lakhs, whatever may be your salary or whatever you are earning by your own, this is something which you are earning for a limited time of period or limited time of audience. When you are making an impact in that person's life, when you are continuously monitoring that person in terms of, and the person is very faithful and loyal to you as a naturopath, for the belief you have installed in him, that change starts from there. And the second belief is like every system within the organism loses some of its characteristics when its components undergo the change. Okay. So we need to very much understand that the components of a system will lose their nature, function, and significance, even in their existence, when removed from the interconnection. For example, if you're treating only diabetes as a pancreas-based disease, or if you're treating pain only as something related to inflammation, and considering inflammatory markers, reduction is the ultimatum, or you're treating autoimmune condition just as something to do with the immune system. This is something very wrong approach, because the system, when it is separated, the particular organ which is separated and isolated and focused too much of intervention, that is going to create an impact on that particular person. And the way we treat our patients, we can see like now when a patient is coming to us and we want to give a yoga therapy to a particular person, what are the common prescription making pattern we have? So if I ask you to give a prescription for osteoarthritis, okay, in terms of yoga, for example, what are the common things you recommend for osteoarthritis? What are the common things you recommend for osteoarthritis in terms of yoga? Okay, there is no right and wrong answer. Nobody is going to judge anyone over here. Okay, Dr. Bashira is telling stretching, general exercise, strengthening. I'm saying about yoga. We'll go for IAYT approach, warm-ups, loosening exercise, Janu Naman, muscle strength, Sukshma Vyayam, passive asanas for knee, Sukshma Vyayama, Asan. Okay. PET. So it will cover as a whole. Okay. So you can put it to the group and nobody is going to judge anyone. Like we are all here to learn. I am here to learn from you. You are here to learn from me and each other. Sukshma Vyayam, oxygen increasing all asanas. Sukshma Vyayama along with breath awareness. Okay. So, but if you see, yoga is supposed to be the mind-body medicine, right? When we are like, none of us has spoken about mind, or none of us have spoken about what we will be basically concentrating in that. What about yama and niyamas? Can a person just concentrate on or be on asana without yama and niyamas? Can it be incorporated into our person's mind? And whether yama and niyama has any role to do with this particular things? This is where we are becoming a very, very reductionist person. And even if I ask for naturopathy, we'll be immediately speaking about all those treatments, because we believe that treatments is something which is going to heal. It is not a treatment is going to heal. Treatments are providing to provide a healing environment. But have you prepared the patient to go through that experience? Okay. So when we start making prescriptions bombarded with different kinds of asanas, pranayams, and different kinds of things, you don't have to study for 5.5 years, or you don't have to be a doctor for just writing some asanas or pranayamas. We need to make the patient. It is not only for sages that yama, niyamas, pranayama, pratyahara, and all those stuffs are there. It is for us as well. It is for common man as well. Those is something which is going to create an impact in a particular person. Until and unless we reach that particular thing and we identify those particular things and treat our patients, it is very difficult for us to give something. So especially like what Dr. Esha has told, when we use yoga as a therapeutic tool, this is where we use yoga with a reductionist approach. We do not consider yoga as a holistic approach. None of us spoke about I'll be correcting the patient's yamas and niyamas. I'll be checking with what is the moral values that patient is practicing in that particular case. And we do not consider that because we are so much reductionist. All of us. We just immediately think what I can do. My patient is having hypotension. What I can do for my patient. So today, one of my students just came to me and told me that my mother is having hypotension. So what to do with my mother? So I was asking her immediately. I was not immediately telling that go for this treatment, go for that treatment. I just asked her, do you have any kind of mom has any kind of issues at home, like, or whether she has gone through any bad memories, traumas, or something like that. I was asking to her. So there was something like that in her face, and that is what she's not able to cope. And she does yoga, that her mom does yoga. So the so-called yoga, asana, pranayama, meditation, and whatever we do, sitting and giving those postures. And she practices fasting thrice in a week, and she goes for walking every day to get exposed to sunlight, and she does everything right. And still she's not having a hypotension. If at all we want to address that, we need to heal the traumas. We need to make the person having good vital capacity to cope up with whatever is happening to the body. Okay, so that is why each patient is going to be unique. If you remove appendix from your body, or if you are doing if you're putting a stent inside your heart, if you are doing a kidney transplant, all these things are basically going to affect the body. It is going to create some impact. So lesser the external intervention is what something we need to basically try and achieve as much as we can, and make the patient self-empowered with that particular things. I have given an example. Every organ has an interdependence with others, and it is not just with our body. Our body is dependent with the environment. The environment is dependent on the political forces that I have shown that yesterday. What are the things which impact our vitality? So the nervous system, if you have some problem with your nervous system, it will be affecting your musculoskeletal system, your digestive systems, affecting your cognition, your mood, your social relationships. Everything is interlinked. So if you want to become a proper naturopath, and now we blame the system very easily because we do not understand our system. We say that there is nothing left in naturopathy to learn or to do. There are many things available. And I would say, proudly say that naturopathy is the only system of medicine which can save the world. It is really difficult to do that thing, to show that this thing is going to be true. But for that, we need all of us to be in the same page and understand the magnanimity, the pluralistic or multiplistic experience of a particular disease. And the third characteristic is like an organism the changes what happens in an organism do not just occur at your physical or chemical levels. Your biochemical normality is not what is so-called normal, or having a proper physical. Like if you look at me, I may be looking healthy, but whether I am healthy or not, it depends upon when my naturopathy physician interacts with me and try and understand whatever it is there in me. And I am not defined by my cholesterol level, my blood sugar level, my inflammatory markers level. It is not. The characteristics of a person do not change at your physical or chemical levels. That is why when you look into your iris, the person may have diabetes in laboratory report. You might have a HbA1c 7.7%. When you look into your iris, you cannot see that kind of changes in your pancreas area or your digestive systems area, because we blame iris cannot diagnose things. Actually, body does not consider. For him, maybe 200 milligram per deciliter because of the continuous flight or fight mechanism is true for that particular point of time. We define those normal limits. We define what is called abnormal in a person. But the body is not defining. We are expecting the iris to show something in your pancreas, or iris to show something which is actually showing in your laboratory reports. Laboratory reports are man-made reports. The body considered in a different way. In a holistic point of view, the change is not necessarily which is happening at your physical level or chemical level at that point of time. It requires a little more higher level. It is like very subtler. It is happening inside that particular person, which is interacted with everything around this world, whatever the ecosystem that particular person is placed in. And this is what a naturopath can do to a person, looking beyond the physical and the chemical levels and looking for a higher level of a holistic integration. And these all are published literature. None of us are using this because we are so much into asana pranayamas and giving mud packs and hip baths. And there are important interrelations that define the systems. These may completely missed in parts only perspective. When you look into different things as small parts, we cannot understand the interrelationship within this. We are completely lost because we are so much overwhelmed about the modern medical knowledge what we have in terms of physical knowledge, in terms of your laboratory reports, and many are so much so that we are treating the laboratory reports, not the patient himself. So interrelationships are completely independent of how a part behave in a particular situation. You may have a pain, but the pain solution is not necessarily the inflammatory marker. It is little more higher than that. Every function has a very complex interrelationship between your blood supply, your nerve supply, your enzymes, your hormones, the environment where you are. These all are interlinked in these complex relationships. And we are trying to reduce this into simpler concepts. Diabetes, this; cancer, that; hypertension, this; that. We are kind of reducing this complex relationship into a way where we can easily approach. And if you look into the other way, it is very complex. If you suddenly, if somebody is not believing in your blood sugar level or blood cholesterol level, what we will do? Where we will go for newer concepts, because we are so much dependent upon having those concepts for treating our patients. We are treating the laboratory reports, not the patients. Moving ahead, what is required for bringing in this kind of change? So yesterday also I have been discussing about this. So there is a saying by this particular person: one of the most difficult duties as a human being is to listen to the voices of those who suffer. Listening is hard, but fundamentally a moral act. How many of us are like, we just blame Google knowledge? We just blame person that what he is, how he's presenting himself to you. The role of a practitioner is to develop a therapeutic relationship of rapport, empathy, and authenticity to serve the patient's choices and engender the healing process. It is not that you are going to apply your knowledge and trying to bring in the change. You need to develop a rapport and empathy to that particular person and make, if at all I want to share something which is very personally bothering me. Okay. So like, this is a very common occurrence. Like even in our hospital, when I send my final years for making a consultation, holistic consultation, on the first day, they come back with, the patient is having low back pain. The patient is having knee pain. The patient is having diabetes since 15 years. So they make a conventional diagnosis and ask, like, I'll be teaching every day, and I'll be just asking them, like, have you found anything which is like very much personal to that particular person? Did the patient share? How is her social relationships, relationship with his wife, husband, kids? What is her whereabouts? What are the kind of traumas she has undergone? How is her mental status at that point of time? On the first day, all the students, irrespective of whom they consulted, everyone come and says me, the patient is very optimistic. The patient's life is so good. She is looking everything into a positive. Even diabetes, she is very much positive about her diabetes. It is not enough. The patient will not open to you until and unless she develops or he develops the comfort to you. I will not be saying that I have an erectile dysfunction on the first day to you, right? I cannot say, because sex is something which is forbidden in our country, and we don't speak about sex. I will not come and say that I have an issue with my wife. I will not come and say that I don't like in the place where I'm working. I will not say that I'm not getting enough sleep because this is bothering me from a long time, or somebody was abusing me from a longer time, and I won't be saying that. And we have a hidden history of individual element in every person you treat. Believe me, and if the person is not sharing that with you, you believe that you are not in the right track. You are not developed that rapport or the relationship with that particular patient. And they also want to have the transient relief for some time, somebody to listen for whatever they are saying. The patients need to be heard. The patients need to be addressed for their problems. For that, you need to allow the patient to speak, allow the patient to speak for as much as he can, express everything in his mind, so that he can reach to the root cause of a disease which is beyond your physical and the biochemical levels. The patients are not at all defined by the biochemical parameters and nor by their physical appearance. Being obese does not means that it is something to do with the patient is eating a lot of food or the patient is having a kind of hypothyroidism. It is not like that. They may be eating only 2 chapati, 2 rotis, or they may not be eating. They may be fasting for 7 days in a week, but still their weight may increase, or still their blood sugar will not come under control. We should listen to the patient. That is a primary thing. Naturopaths must never forget that each patient is an individual with their own unique story of illness and treatment. Every diabetes patient is not the same. Every obese patient is not the same. They have their own unique story, why they have become obese, when the first flight or fight mechanism started in that particular person. and how it is continue to be having flight or fight mechanism irrespective of whatever treatment you are giving. If your treatment is not going to the subtler level of the mind of that particular person and bring in the change, because your gut will change, your gut flora will be changing only when you reach to that particular level. The patients, when you are allowing them to tell their story, and in turn, naturopathy practitioners listen with sensitive, authentic attention and empathy. When the patient feels they are listened, they open up and declare hidden information that can be clinically very, very, very significant to the type of treatment given and how well that treatment works. Here, the word treatment does not mean that real treatments what we are just taking. How much to intervene? What are the kind of intervention that particular person needs? Whether he needs a counseling, he needs a pat on the back, whether he needs a immersion bath, or whether we need to change the thought process, the kleshas need to be removed. All these things can be determined only when the patient is opening up. Otherwise, you as a physician, you will be clueless on what is happening. Okay. So narrative medicine is something which is really coming up in a larger way. And this particular reference you can see down about the narrative medicine. It is about the patient needs to open up to give that particular element which every naturopaths want to find and treat a particular person. Otherwise, anyone can give the so-called treatments what we are prescribing every day. There is no meaning in prescribing treatments and calling ourselves as a holistic system of medicine. We are not holistic system of medicine if you are just going behind prescription-centric practices, or if you are becoming disease managers who manage physical and biochemical parameters. Our approach has to go beyond that. If at all you want to make that kind of a sustainable change, what everyone is aspiring to make, and what is the power of that particular naturopathy if you want to see. And when you do a holistic inquiry, if a naturopath does not holistically inquire the patient's presenting complaint and merely follows a protocol, for example, insomnia, a patient is coming to you and I'm saying, doctor, I'm not able to sleep. I'm like, I hardly sleep for 3 to 4 hours. Okay, so we heard that. Immediately, the reductionist person in us will be writing hot foot bath or take an acupressure to the head or acupuncture to different points. Is it that going to heal that patient? It is like giving a chemotherapy for cancer. It is not going to heal the patient. It may work something on a cellular level, not beyond cellular level. And we speak about a lot of things like Reiki, pranic healing, energizing technique, quantum physics, and all the stuff which is really there. And it is just in the terms of speech. We do not really think more than that. If you treat the insomnia as a condition which is something related to your nerves or something related to do with the physical body, and immediately write a hot foot bath or give an acupuncture or give an acupressure or give a spine massage or something like that, whatever you're writing, because you are going to follow a protocol which you believe that is going to induce sleep in that particular person, that is going to be a temporary solution. How many patients you have treated like that? I have failed many times as a young naturopath in the initial days. None of my patients or many of my patients failed to get a sleep after hot foot bath. So at that point of time, what I thought, naturopathy does not work. Or even after acupuncture, the patient is not getting sleep. I was known to be a very good acupuncturist back in 2012-13 when I was practicing in NIN. Because I was practicing modern, not what Dr. Gurudat sir is practicing a traditional Chinese medicine practice. I used to prick using Anton Jayasuriya's textbook, clinical acupuncture, point-based technique. I used to get transient results and people were happy, I am happy, but I was not understanding what I'm doing. But when you start, when people are praising you for doing something, it's very good. And when suddenly the same points does not work for some patient, I really doubted myself whether it is my skill is a problem or acupuncture does not work. It is not that acupuncture does not work. It is not that hot foot bath does not work. You as a physician, you do not use your brain and understand the wisdom of the body, the wisdom of treating the individual person holistically. A practitioner needs to be aware that the holistic consultation, what you're doing, is not a routine even for that patient. It is dense with the meaning and represent the turning point for your patient. It is your responsibility to make an impactful change, because a holistic consultation does not take place every day for that patient. You are not the same doctor he might have met for all his lifetime. You are the person who is going to change the perception. It is not about side effects. It is not about how different you are from modern medicine doctor. it is something which is going to have a dense meaning in that patient's life. From there, it is going to change. And the change does not mean change in blood sugar, blood pressure, your laboratory reports, hypothyroidism levels, TSH levels. It is not that. That is not something which we are concerned about. The change is about the approach. The change is about what that particular person thinks and does after that particular consultation. This is what we basically try and achieve and try and do in a holistic consultation. And for that, we need to have all our armors in our hand. We need to have all our tools equipped in our hand to make the patient speak to you. And try this tomorrow when you get a patient tomorrow. And tomorrow also we have a class, right? In the morning when you sit in your consultation, try this approach to a person where you have already started treating with your so-called disease management protocols, and try and listen to that patient a little more and try and inquire a little more. If you have already developed a rapport with that particular patient, ask about his personal choices, ask about what are his belief system about a particular disease, how he is in his social relationship, in his physical relationship at his home. Now, all these things you basically ask. You will find, even for pediatrics, even for small kids, it is very fascinating. Believe me, you can treat any condition in the world if you understand the patient and if you both are on the same page. And now why we are scared to treat cancers, or we are scared to treat many other conditions? It is because we are scared about the laboratory reports. We are scared that patient may die because the laboratory report says so. And we are not ready to believe, or we are not ready to even explore, or we are not even ready to install that confidence in that particular patient and try and treat that particular. How many times we have tried to say that we are a failure? We have never tried. We have never even attempted, because we are so much dismantled or impaired with our thinking and the thought process about what laboratory reports have seen in your face. And people die. People will have pain. And this is a very common process every day. And it is not that we are killing a patient or the patient is dying in a modern medical hospital also. Drugs are not blamed at any point of time. How much you can bring in that change in that particular patient, how much you can improve the quality of life in that particular patient, that definitely is going to matter. So in a holistic consultation, when you are going and placing yourself as a physician in front of a patient, in a holistic consultation, there are 5 steps we need to basically determine, which has a larger impact on how the progress of a consultation is going to be and how the case report taking is going to become effective. Okay. I'm sure like many of you might be bored, I don't know, but this is what we need to learn as a person. Like without philosophy, you are not a naturopathy physician. You are just a person who prescribes treatments. Without understanding the depth, like if you ask Ayurveda persons, they have Vata Pitta Kapha. If you ask homeopathy, they have Similia Simplex and all those stuff. And if you ask Siddha person, Unani person, they all have a concept behind what they do. And what is the concept which is guiding us? We do not even attempt to do that, because we are kind of weaker in understanding our philosophy and applying that philosophy into our practice. So when you do a holistic consultation, these 5 phases are very, very important for us to go ahead and do that particular holistic consultation. First one is to explore. What is meant by explore? The task in exploring is to establish a rapport with the patient to help the patient reveal, identify, and describe their problems. As I told, if I am transferred to Bhopal, now I'm in Bhopal, I was in Pune at that point of time. Pune is a metropolitan and Bhopal is considerably a kind of a corporation. So when I come here, initial days, my wife, we ourselves got a very like acclimatization issue. We had a lot of problem in settling down. We have nothing to do after 8 o'clock where we used to roam in Pune and all the stuff we were doing. And here we do not have anything. So that may be on a longer run, it may be bothering my wife. She was initial days into a kind of not liking this. She want to always go. She was getting some kind of symptoms like pain, this, that, and all. And it is not ideally because inflammation has suddenly gone up. It is because there is something which is there inside our mind, which I need to make her to reveal, identify, describe the problems, make the person accept that this is how you need to change. This is what you need to change. This is the approach which need to be changed. That is what you need. And unless, like if I ask my wife, what is that bothering you? She don't tell to me unless I don't feel offensive about what she is telling to me. Or if she really feels that I'm listening to what she is telling. So the naturopath's empathy, like we have a 6-year-old daughter, and when we decided not to vaccinate our kid, okay, for none of the vaccines. So it's a very difficult situation for, she's a biotechnologist. So she's so much in love with killing microorganisms. I am a naturopath. I am not in love with killing the microorganisms. I am in love with microorganisms. So we two are from two different type of practices. And when we decided for not vaccinating our kid, I need to make them understand in a way they understand, in a kind of a picture, in a kind of a, what to say, the way of explaining that particular thing. It need to be explained to that particular person, and then she understood. Now we have a healthy kid without any issues, and we never use antibiotics, we never use any kind of stuffs to our kid or even for ourselves. We both got COVID, and we have not taken a single medication so whatsoever which is prescribed by ICMR or whatever. Okay, so this can happen only when the patient is ready to understand the body's wisdom. Dr. Jyoti Rani Singh has shared a case. I'll explain during the break, that one. Okay. So when the naturopath's empathy with the patient will sensitize the practitioner to the tone, pace, depth, and breadth of the inquiry, the patient's health issues can be adapted. And remember, health is not independent of disease. Health is inclusive of disease. Disease is a part of being healthy. The patient in this process has an opportunity to share their thoughts, their feelings, and for the naturopath to join with them to identify the problem areas in their health from a holistic perspective. How many of us does this? Our exploration ends when you have an MRI report. If a person comes with fibroid uterus, you are very happy, PCOS, you are diagnosed and you started treating with doing butterfly stretching, go for Halasan Paschimottanasana practice, eat fiber-rich diet, and have sunlight or take vitamin D, you will be healed. He's not going to be healed. They may reduce 4 to 5 kg of weight, or the fibroid may go off in a day or in a month or two, but they will be coming back with again the same problem with you. Or they may be changing the doctor because they are getting a recurrence. That can be healed only when we understand why there is a fibroid in first place. Why it is happening in for that particular person in the first place. It is not the ovary started behaving weirdly after a long time. There is something which is beyond that, which we need to understand. So that is what we do in exploring. The second one is to understand the problems involves a focused attempt to gather more specific details about the problems experienced by the patient. When the patient is saying that I am having pain, it is not just, oh, back pain. Immediately you should not think that the disc will be out or the patient will be having a wrong ergonomics. It can be beyond that. Many times it can be that as well. It can be beyond that as well also. So if at all you want to provide a relief completely, you need to go beyond that. The knowledge gained from this helps in the patient to acknowledge the areas of strength and weakness. It is not about you. When you take a case report, it is about the patient. What is our role? Don't forget doctor as a teacher. Do not do any harm. Prevention. The patient need to understand what are the areas he needs to strengthen or she needs to strengthen, and to develop newer insights and perceptions that will help them to relate their health issues holistically. And the patient is telling that my blood sugar is going up. You are also starting worrying in the same way that patient is worrying. You both are on the same page. You're actually inducing more flight or fight mechanism to that particular person. And if you can convince your patient that this is not going to affect you and this is not going to define you, they can think about that problem more holistically. And you see, this is a very, 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 very important approach if at all you want to become a real naturopathy and yoga physician, or you want to become a therapist. That is completely up to us. And this is why we feel others as a competition for us. Now people are a competition for you. If you really take your space in wherever you are practicing, add some fine elements to the practice, add some fine elements to become the naturopath we aspire to become when we took the BNYS course. And the next step, once you understand, you have explored the problem, you understood the problem. It is not about you understanding. The patient also understood that this is a problem. At that point of time, we need to set goals for that particular patient. The goals is not you need to reduce 10 kg in 10 months. No. The goal is to negotiate and strategize to achieve positive outcomes of health, which is related to their vitality. The naturopaths need to discuss with the patient the type of modalities we are going to use. Modalities, again, does not just related to hip bath, spinal bath, yoga. It can be any approach what you are trying to put in that particular person. It can be an anger management as well. You are putting to that particular person. And whatever you are posting, just post to the whole group so that everyone can see and appreciate what you are trying to discuss. I really appreciate you putting in the chat box, but put it for everyone. Don't send it for me directly. I'll discuss that. It is appropriately at this juncture, we will be trying and identifying what is that prognosis. So prognosis of a cancer, prognosis of a diabetes, prognosis of hypertension, osteoarthritis need not be just limited to the pain relief. It is like changing the person as a whole, changing the perception of the person as a whole. And they can also discuss with the naturopath their preferences for various modalities, and the naturopath can highlight when the patient can expect as their high health outcome. So never speak about disease. You can speak on disease for hundreds and thousands of hours. Speak about health. Speak about how disease is an integral part of being healthy, and how we can overcome that temporarily diseased stage by addressing the things rightly in the right way. Okay, so there are a couple of comments which we got from two people. One, first I'll take from Dr. Jyoti Rani Singh what she has added. So you can see in your chat box, I'm posting on behalf of her. So, sorry, I'm posting now for Sonia. So I'll post for everyone, the first one. So she got a male person about 30 age with cardiomegaly, splenomegaly, hepatomegaly, along with AIDS. After taking case history, I asked him to maintain a healthy diet and routine well. So if you see this particular AIDS as an example, so I worked with NI and we had a AIDS sanatorium where AIDS is more of a social disorder than an immune disorder. I have seen people recovering in terms of their immunity, in terms of their weight, in terms of their hemoglobin, happiness coefficient, everything, when they were with a person, group of people who were supporting each other and trying and doing good with them. The moment you see AIDS, I have asked this question to my college students. Will you be sharing your room with an AIDS patient if you know that a person is having an AIDS? And will you be comfortable in sharing a room with your AIDS patient? They said no. And that is what defines AIDS. The person's perception kills the patient faster than the disease itself. And none of the disease is incurable. Every disease we can cure. Every disease we can heal. We can provide, be it AIDS, be it any disease. AIDS, we have seen people getting into negative viral load reports. We have seen patients. And thanks to Dr. Babu Joseph, who has installed this kind of confidence in us to look into patients with a different perspective. And there is another one case which is shared by Dr. Mansa Mishra. As you told, philosophy is very much important or base of naturopathy. Why is not mentioned as a priority in naturopathy principle? Last only one, it's small glimpse. But why is not? So why it is not prioritized? Who is to be blamed? Naturopathy or the naturopaths? It is the naturopaths to be blamed, not the naturopathy. Naturopathy is already existing there. It is available there, and we are taking part and pieces of naturopathy and saying that naturopathy is not good. It is very, very good. The naturopaths need to be blamed for the state of affair where naturopathy and naturopaths are in. We are not discussing this because we find this is very difficult to follow. We are not discussing this because we think that people will not listen to us. We have never tried this for ourselves. Let us try this for ourselves. Let us try this for our own body, our own family, our own community, and then we can make that judgment that naturopathy does not work. It works. And finally, what we will be looking from all this particular thing is giving certain treatments. So treatments, basically, it is not that they should be there in your hospital for 2 months, 3 months, or taking the treatments continuously. The treatments is about assisting the patient in gaining better vitality. So I have defined what is vitality, building health resources and skills and lessening health deficits. So the patient's role is to acquire self-help skills. You need to identify and acquire self-help skills. Okay, I'll give a break in 4 minutes. And maintaining the patient's self-motivation. We should discuss about the potential barriers. When you say about certain thing like don't be angry or follow truthfulness, or we say to the patient that do not consider blood sugar level as something. So the patient will come back to you. Doctor, my blood sugar level is shooting up. You told that not to consider about blood sugar level, but I am worried. My friends are telling this. My wife is telling this. I myself am worried. You need to have an answer to give that confidence. Like it is, as I told, Herring's law of nature, the patient will experience all the things they have gone through when they are going to go through a healing crisis. It is a klesha, the fear, abhinivesha, the fear of death and disease is something which is blocking ourselves from being successful. So we need to break that viparyayas, break those kind of things which is so to say chitta vrittis which is coming in our mind, which is the modifications of mind, which is actually afflicting us from progress. So our treatments goals should be breaking all these particular stuff which can reach to the root of that particular patient and make the patient treat and feel the holistic benefit of naturopathy as a whole. And as a final goal, what we need to basically do as a naturopath, what we are basically trying to do as a naturopath is to provide the independence to the patient. The task is to ensure that the patient has necessary self-help skills and is prepared for the naturopath's helping role to the end. So you will be continuously mentoring, monitoring that particular patient, but it is more about the patient, not about the doctor. The naturopath can assist the patient to plan independent control of their health. This is what that sustainable health goals, what Mahatma Gandhi has been telling. Okay, and the patient can now consolidate all the learning and is ready to implement the self-help skill in their daily life. It is a kind of everyday doing. So we always say that naturopathy is for both the healthy and the unhealthy. Because healthy doesn't mean they are healthy, unhealthy doesn't mean that they are unhealthy. It is a progression. It is a kind of a continuous process which we are trying to do in our patient. And ultimate goal of every naturopath should be providing the independence from disease, independence from doctors, independence from biochemical reports, independence from the inflictions or afflictions of the disease which is haunting that particular patient. And imagine how much we haunt our patients. Okay, so let us take a break. I'm giving an independence now for 5 minutes. We'll meet you back by 8:05. And meanwhile, if you have any doubts or something you want to add, you can add in the chat box. So join back by 8:05. Okay, so we can just get started. Okay, so we have been speaking about the independence of the patient. Is the final goal of making this particular consultations. And moving ahead, so we have different types of naturopaths in us. Like when we see ourselves, we have different types of naturopaths in us. Okay, something is like when we start as a fresher, we are novice naturopaths where we tend to use the learned protocols. We always will be looking for newer disease patterns, protocols, what we do, all these things. Basically, we try and do like what is the points good for treating this particular thing, or what are whether hot hip bath is good or cold hip bath is good. So we are more focused on these protocols and the treatment programs for a disease or syndrome. This is something we are a novice naturopath. A novice naturopath can be fresher, or even after 30 years of naturopathy experience, you can be a novice naturopath also. The next level is advanced beginners, where we soon find that one size fits all approach is contradictory to the naturopathy philosophy. Okay, we cannot have the same hip bath. Is there some problem? Somebody is okay. Yeah, thank you, Dr. Kinchal. So my book is available from that link. Those who are from India, US, and Canada can buy that book from that particular link from Amazon. Okay, so now the next step for what you basically do is like novice naturopaths. You will be giving treatments. Like as I told in 2011, I was just thinking that why acupuncture is working for some condition and for some condition it is not working. And later I understood that it is one size fits for all approach does not work. It is contradictory to the philosophy of what you are doing. And is problematic, and you try to adapt to vary the protocols to each patient, the need of each patient. So that is advanced beginners. The next stage, you become a competent naturopath, you begin to develop your own independent strategies for your patients. None of the area I'm using any type of treatments. I'm not going to teach you the treatment prescription, but I am going to teach you what should be your approach in writing a treatment. I'm very sure that you all know different types of treatments to be prescribed to people. What we do not know is like why we should prescribe these treatments. Now, when you look into these things, the fourth one, we become professional naturopaths. We develop treatments based on traditional learning, evidence-based practices, and the intuition in selecting the treatments that align with the patient's individual holistic cause of ill health. Okay, the last line is very, very important. The patient's individual holistic cause of ill health. So somebody has commented in the group I have seen, she has not posted it to everyone. I feel it is very difficult to make a patient understand that he should not only look into reports and also look at his state of mind, and his state of mind has caused the disease. I am also acknowledging it is very difficult. It is a word of the doctor who has told this. I am also telling that it is difficult, and achieving the difficulty is what really matters, because good things, nice things will not happen that simply. If it is whatever we have believed so far, yoga is very popular since 2013. And there are a lot of naturopathy hospitals, institutions, doctors available, and there are Ayush systems of medicines available. But are we reducing any number of diseases? In fact, we are getting newer diseases: monkeypox, smallpox, chickenpox, COVID-19, SARS-CoV. We are getting newer diseases. The number of diabetics are increasing, number of hypertensives are increasing in the number. We are not getting any kind of real benefit in whatever approaches we are doing so far. Right? None of our patients are getting any kind of benefit. The numbers are increasing. The number of deaths are increasing. The newer diseases are increasing. So should we change our approach? It is tomorrow, it will be us or our parents, our families. Okay. I lost my father when he was in 2 years back before COVID. So he was 59. He spoke to me by 7 o'clock in the night. And then he went to bed by around 10 o'clock, and morning he is no more. It is a personal loss for us as a family. But you say, as a naturopath, when I look into the way he passed away, it is bliss, right? You should die like that, in terms of like, you don't have to be in ventilators, having chemotherapy on your head, amputate your limb. Is that a good death? It is like death should come in such a way that you are not feeling that particular death also. That is a quality of death we all should dream for. And death is not something very bad. We are very much averse to death and pain as a society. So in my book, there is a chapter on pain, death, and our threshold to that particular thing. So we as a naturopath, how we treat birth, in the similar way, we need to treat the death as well as and the pain as well. So there is another one question from someone. If a patient asks whether I'll get cured through this or not, but actually we can only provide improvement to his severe nerve conditions like paralysis, how can we convince those patients? If we tell them it provides only improvement, they lose their confidence in our system. What is mean by cure? Cure means that thing is not going to occur again in their life. That we are again, can we promise that? Can anyone in the world promise that something will not happen to you? It is not in the hands of doctors. And I am not saying, don't mistake myself like you are not treating a patient. You're definitely treating a patient. I'm not trying to convert yourself a psychologist or counselor. I'm saying the approach with which you treat a particular patient is going to differ. Paralysis patient, you're definitely going to take, you're going to give physiotherapy, or going to give all those treatments. I'm saying that along with that, these are called conservative approach, what you are doing. I'm saying there are 3 layers of treatment planning, which I'll be showing at the end of the slides today. The treatment planning is based on how you approach a particular patient and how the patient is getting benefited on a longer time. It is not like we are saying that it only provides improvement. It definitely, there is nothing called cure. It is about healing. We are providing that healing that to that patient. You are already doing that. I'm saying add an element to that so that the effect is going to be sustainable. Okay. Yeah. So then the final one is experienced naturopath. You will be having immense understanding of traditional wisdom, the evidence, and can relate to the patients very sensitively, and then you can address to the problems of the patients very sensitively. That is what makes if you can understand the patient's issues, and for each patient's personality, you can motivate, educate the patient, and you can rapport with that particular patient very easily and bring in the individual level changes in that particular patient, which will be reflecting in their environmental level, which will be reflecting in their physiological level, and it can remove that name of so-called disease from that particular patient. Have you seen many people recovering from cancers, recovering from they have gone to many hospitals, but this doctor has treated me? It is because they have reached the root. They are able to penetrate the individual causation of that particular disease. That is why we have terrific difference from person to person in the way they recover and recuperate. And when you take the case taking, for example, the first thing what we'll be asking about location. What is the nature of the problem? It is not location means immediately don't get conventional on the right quadrant of abdomen, left quadrant of abdomen. That is also important. Along with that, you get an idea about the physical, emotional, spiritual, and environmental dimension of that particular problem. That is the location, the seat of the problem. It is not in the patient's body. It is not only in the patient's mind. It is not only in the environment. It is there in everything. It is connected. And onset. What is that factor which initiates that particular trigger? And also, we will be inquiring patient before and at the start of the problem. What are the things she has gone through? It may be 10 years back. It may be 2 years back. It may be 2 days back. And the course of the problem, how it is going to fluctuate, and what are the things which is fluctuating, when she is feeling a relief, when she is not feeling a relief. So we recently got a patient, one of my students only went and took the case report. She's having diabetes or some sort of trouble. So she came and told, I always ask like more than provisional diagnosis and all the stuff. I asked about what is the individual problem of that particular patient. This is what I want my students to find in my patients. So they go, she came back and told me that, sir, she don't have any individual problem. I cannot make out any individual problem. She's a very spiritual person. She reads Bhagavad Gita for 6 to 7 hours a day. And she's feeling very happy about being spiritual. How many of you think that this is a problem? Do you think that reading 7 hours of Bhagavad Gita or any, I'm not taking any name, don't be offensive about the name of a book. I'm saying you're spiritually oriented to something. When you are not finding happiness in the kind of things which you are regularly doing, you will be inclined. It's like similarly like taking heroin. Similarly, like getting addicted to alcohol. If you are indulging in anything more than what is enough, be it Bhagavad Gita, be it Quran, be it anything what you want to indulge, it is similar like you are abusing your mind and body. Any patient. So she had a different problem. For that, she had found out a solution. Why people drink? Drinking alcohol is not a problem of the psyche. It is a problem of moral. If it is a problem of the society. So we need to understand that in that perspective so that we can find that individual cause of that particular patient. Like it looks very difficult for all of you because this is first time maybe you are hearing this particular thing. Excess of anything is not good. Yeah, my Hindi is not good. So I cannot just comprehend it very easily. Thank you for the translation. So if you see the course of the disease, location and onset of the disease is very, very important for us to understand. And imagine if hundreds and thousands of naturopaths like us, we go in this route, we can heal all the diseases in the world. We can actually make the world a better place for people to live with their own independence and freedom from disease. Okay. And then you have to take the general passage tree. It is very, very important to understand because from every component, we will be getting an individual perspective. We want to try and understand what is that changed in that particular person's environment, in the person's spirit, in the person's social factor. So then only we can determine what kind of treatment we need to give for that particular patient. So general level of vitality, somebody will be coming and telling, sir, as a child, I always fall ill. As a child, I was hospitalized. I had this problem, that problem. I was always emaciated or people bully me from my childhood. Like I was not having proper healthy nutrition during my diet. So I was very obese in my childhood. Now I am healthy or I got diabetes. So you need to understand the vitality in the childhood. Every person has a vitality and how the vitality has affected the life stages such as puberty, education, the relationships, marriage, pregnancy, parenting, and work. So people ask, naturopathy doesn't have any emergency medicine relief. What is that emergency? I don't understand. Until and unless it is an acute emergency, life-threatening, there is no emergency. As such, emergencies are created. It's a perception. So if you see the delivery pain, the normal delivery pain is the most worst imaginable pain for the mankind. People are thriving to that and coming and delivering their kids so that any pain can be tolerated. None of the pain is so heavy that of a delivery pain. So it is we as doctors, we should change our perception and thresholds for pain. We as doctors, we need to change our perception and threshold that what need to be called as emergency or what need not to be called as emergency. Many a times our mind functions faster than the real thing which is present in front of us. We need to develop a lot of plasticity in us as well as our patients. If at all we want to provide, we want to remove, we are in an emergency situation always. Now also we are in a very much urgency. I am in an urgency, 9 o'clock, I need to finish so many slides. You are in an urgency, you need to go away and look at your household chores or whatever you are practicing as of now. So these all have a problem. And if you say so much so that a female child, for example, and there are a lot of female participants over here, my fellow naturopathy doctors. If I want to describe, if I'm asking all the female participants over here, I want you to describe your emotion about menstruation in a single word. Can I get some words from you? Menstruation as a single word. A single word, you need to describe your first thought about menstruation. Pain, negative phase, routine, stress, painful, cyclic meditative process in me, cramps, frustrating, cramps, painful condition, bleeding, crying uterus, mood swings, month cycle, mood swings, cleansing, irritation, panic, irritation, cycles. Don't copy paste others. Okay, fine. We got enough detox of the body. So we had got some 2 positive responses and most of the majority, and this is a common representation. There are studies on this. Menstruation is never a good feeling. When you do not feel good about menstruation, that is the stress which is starting from your body, and that is why you are ending up in 35, 36 hysterectomy or fibroid uterus or abnormal uterine bleeding or CA of cervix, and all these things happens because of that. Because it is not created. I'm not blaming any of the female colleagues of ours for having this kind of thing, because the beginning of menarche, so much customary things are done and it is created as a very different entity. And we don't allow people when they are menstruating to touch plates, to touch their husbands or touch the like all the puja things, what you do. And we create an untouchability within our own universe when they are having this menstruation. So none of us have positive experiences about menstruation. And the women go through this is like very worst stage of their life, like because it is a kind of a perception and beliefs around that particular menstruation. So this is also going to be a triggering factor. If you understand this, this is also going to be a triggering factor for treating your female problems. I'm just saying we all are doctors. Have you ever considered this feeling about menstruation is going to be a problem? And many of you might, or many of you might have. I have seen Dr. Abhirami saying it is cycling meditation process for her and detox of the body from Dr. Neelam. So we have different kinds of concepts in our mind, but I'm saying majority of our patients now, since you are doctors, you are giving this kind of reflections. But think about the common people. How many people have gone through difficulty when they are delivering their kids? It is like every person has their own chunk of problem, which we need to elicit and we need to relate things and try to give a holistic solution. Then the immunization, vaccinations and the reactions, the allergies and intolerances from childhood, any illness from the childhood, which is very much related to how they are becoming in a I'll be sending the slides, Dr. Ebenezer, at the end of the 3rd day. As of now, I'll be sending the videos as well. Okay. If you are finding it poor network, please join again. Okay. So everything, like how much time you have hospitalized, what is the mode of your delivery, whether you have been breastfed properly, any kind of major illness, accidents, these all have a link to your the way you are going to have your condition in future. And after the family history is very important, because how a family, they are treating that particular condition or kind of genetics. So genetics is something, but always saying like, if my mother is having diabetes, I will be brought up in such a way that you will also get diabetes because your mother is having diabetes. Your mother got a CA of breast, you will also getting a CA of breast. Be careful. We are putting the surveillance camera at the start of the person when they are getting their menarche or when they are becoming an adult and growing ahead. So this family history and their impact on the and family history doesn't mean only diseases, the domestic violence, or if there are any kind of interpersonal relationship issues, all these need to be identified in order to make a better prescription making. And then we have two more components. One is lifestyle history that you all generally take, exercise, fitness, coordination, the strength and all those stuff, recreation and entertainment, holidays, very important, alcohol consumption, coffee, tea consumption, smoking, daily exposure to toxins, pollutants, how much time they spend in outdoors. Whenever yesterday I asked a question like how much time we spend in outdoors, we are told from ranging from 2 minutes to 8 hours, we have got different responses. When we want to make the so-called change, why we are ready to go and do a bypass surgery, but we are not ready to take 10 minutes of sun exposure. So who is not getting convinced? Because we are not convincing enough to the patient. And how the hope conditions, their social, economical, financial, and political conditions, health issues, and the military services, if at all they are being through any kind of trauma, we need to basically understand. Thank you, doctor. And another one component of case report taking. See, this is the worst. This is what Dr. Babu Joseph sir told me long back when I was in 2011. When I just step into NIN, told me 1 hour consultation, 45 minutes of consultation. Do you think that this thing will finish in 45 minutes? You do not think. Minimum 1 hour to maximum 5 to 6 days, you continuously interact with your patient. It is not about you are prescribing morning heat bath, afternoon diet, evening this. That is not going to heal. That is not going to provide any so-called naturopathic or holistic experience to our patients. The psychological history need to be understood. What is their level of life satisfaction? And this will change in us. When you change, your patients also going to be changed, because your patients do not know what to expect from you when they come to a naturopathy center, right? They come, you are marketing yourself as a doctor. Definitely you are a doctor. When the patient coming to you, the kind of experience that patient is going to go through is decided by you. Sir, sunlight exposure, different kinds of allergy and skin problems. It depends from person to person. It is not per se the sun which is producing the allergy. It may be the kind of concepts which we have. We need to take it from individual case to case. That is what I am saying. So that kind of consultation, you need to just go from individual case to case. We need to basically look for. So what I'm coming to tell you is about the experience of the patient for the holistic consultation. For him, it is a first experience on naturopathy consultation. We all are social workers, whether we are a naturopath or not. For the answer for Ume Maheshwari madam, we all are social workers. I'll come to this particular chat at the end of it. Can we change the mental status of a young woman who is constantly hating her menses? Because that is what I'm saying. I just took as an example as menses because that is very much closely related to all of us. We have seen our mothers, sisters, you guys, my colleagues, all of going through this different kind of issues during menses. So I just took that as a very relative menses, especially for a very, what to say, customarily rich country like India. We have a lot of bullshit in the name of customs. Okay, let us move ahead. So how the life satisfaction, relationships connected with friends and family, colleagues, community, this needs to be addressed and asked in a consultation. How he reacts to stress, like I lost my father, okay, it's a loss for me, I told, and how I react to that. I'm saying this again and again because if you read my chapter on death, you will understand that the way you are treating the that is why I took an example yesterday when I told about this example. I may get heart attack, I may get this particular thing. Many of my friends may say, why you are saying big words on yourself? What is that big deal about that? Okay, Abdul Kalam, how he died, how he passed away. Have you seen the way Abdul Kalam collapsed while he was giving a talk in a university? See, it can come for anyone and everyone. Like it is about your life satisfaction and how we are looking into your grief, trauma, coping mechanism. And death is a kind of a disturbance to the continuity of the societal norms, not to a person. You are not going to do a suicide immediately if somebody is dying. You won't do. You will be grief for some day for sure. But again, life has to move on. And it is similar like you are taking a birth. And the mood, perception, sensitivities, motive. You may think that I'm speaking very raw and rude. It is not like that. We have become so much, what to say, sophisticated. And why our patients are going from doctors to doctors? Affordability is very, very high. None of the poor persons come to us. How many of you have treated poor people? Very low amount of people might have treated poor people with naturopathy. Most of us are catering to people who are well able, who can afford being to different naturopathy centers and enjoy massages and nice food and the environment where you are in. And the kind of attitudes, your speech, your gestures, posture, thinking, everything is important. If a person is like for musculoskeletal disorder, I told about injustice is something which is the trigger factor for all musculoskeletal disorders. Okay, and religion, spirituality, philosophy, self-discovery, ethics, the purpose of existence, worldview, meditation, revelation, what is its role in prayer, metaphysics like quantum physics, spiritual and cultural issues in healthcare is very important. Now, seeing this one slide, you will be saying that it is very, very difficult for making my patient understand. Have we understood? Are we ready to do this? You are perceiving for a patient. Patient is going through the first time for that holistic consultation coming in front of you. Everyone wants to solve their problem. Everyone wants to solve a problem in a way that they can live happily. Everyone wants to. Why Gautam Buddha has become the so-called saint? Because he wants to become more blissful, enlightened, no materialistic pleasure. So we don't want to become persons who are not having materialistic pleasure. If I don't have materialistic pleasure, I will not charge you 250 rupees per head. I charged you 250 because I need materialistic pleasure as well. But what I'm saying is like, what we are trying to do is like not too much indulge in anything, bringing a person so much into a kind of a solace station that he's treating every emotions equally. He's understanding what is triggering his disease. That is what we are trying to find, and we are trying to treat in different ways. We definitely give treatments. Like somebody asked, don't we give treatments? We definitely give conservative treatments, but along with that, we will be going and treating the root cause of the disease. Musculoskeletal reasons, problems. I told about the feeling of injustice. Okay, so finally what we have is about the general physiology. You look for system-wise changes, what and all is happening to that particular person. You will be basically looking into that. So these are the kind of basic knowledge you need to keep while you are consulting a patient. Okay. There is some, as we know, sometimes social and family environment also affects. Today I have told a patient, she is severe, having radiating pain. She told me she has a lot of stress in her family, as she mentioned. I have to go back to the same environment. I want to change. See, you cannot change things which is not in your hand, but you can change the way you look into the things. Definitely can. It is not in a single day it is going to happen. It is about the step what we are making. How many of you are satisfied with the job where you are in? Can we go for a poll? You can give yes or no. Are you happy with where you are at this point of time? Can you give a yes or no for that? Okay, Dr. Birami, yes, yes, no, yes, 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 yes. So many yes. It's good to see so many yes. Yeah. So how you are, so many no's as well. How you are satisfied in this particular environment? Is every person's very much comfortable or keeping you comfortable? It is not. You have changed and adapted to that particular environment. Many of you are married. Like everything within your spouses, whether it sync, it does not sync. You need to adjust to that environment in such a way that it is not affecting you. Why divorces are happening? Divorces are happening because they are not able to adjust to that environment. It is really affecting their mental health or affecting the way they are as a person. So diseases is also the same. We have to go back to the same thing, but we are a different person going back, not the same person who came inside your hospital. We are a different person who are going back, and we are trying to find a solution for ourselves. That is what we are trying to do. Okay. So we have a few more things to cover today. Should we continue? Are you guys having enough vitality to continue? We need to cover about treatment planning, a bit of treatment planning. Okay, fine. Okay, so let us continue from where we have left. So now let us see how we basically look for the basic treatment protocols for this particular thing. How to go holistic approach about acute conditions like back or neck pain. Tomorrow I will be discussing about that. I was thinking about which system I should discuss with you. Maybe I'll take musculoskeletal system and some metabolic disorders to just show that how we should approach a patient with any kind of metabolic disorders. Okay. So now let us see that what is the integrative approach for naturopathy treatments, what we are basically doing. Okay. The first thing what we need to understand is the appropriate dose of remedies for a particular patient. It is called posology. Okay. Dose of treatments means many a times it is not necessary to intervene a patient. What we need to give a patient some space and express himself. That is, some patients come to you. In general terms, if a patient has good vitality, they can handle the rigor of more remedies at higher doses and more aggressive treatment regimens of exercise, detoxification if required. If the patient's vitality itself is low, how many ever treatments you give, it is not going to work. That is why sometimes we fail in generating any kind of response in our patients. Okay, so first we need to determine what is the kind of dose we are going to give for that particular patient. The second one, is my slides moving? Can you see my slides moving? Can somebody confirm? Okay, thank you. Yeah. So the second one is about the salutogenesis. So this is one of the very important component which is lately coined by Aaron Antonovsky in 1979. But if you see, this is one of the very important component. Which we need to address. There is one comment from someone. There are conditions which is not defined by lab values or scan. A case with pain in throat patient, thyroidectomy done, have medications underwent Ayurveda homeo. Pain persisted for years, but no appropriate diagnosis. What do you think? Is it related to mind? Everything is related to, I'm not exactly saying mind, don't mistake me for the mind. I'm saying about the environment of the person. Okay. It includes mind as well. Definitely it includes mind as well. It is not that treatments are not working. The treatments is not reaching the area which need to be addressed. Okay. So that's what I'm saying. You can be a magician if you understand the way to deal with people, the way to understand the problems of the people. You can be a real magician. No, I'm good. I'm good. So if you see theory of salutogenesis is all about a theory how and why certain people stay healthy and why certain people do not stay healthy. It is all about this. So as a naturopath, we are here to address that particular fact. Okay. So salutogenesis works on 5 principles. First is health is defined as a continuum based on understanding that although ill, a person still has healthy attributes to build on and is therefore in a state between health breakdown and full health. So we are getting people in between these two phases. It is not that there is end of life. When there is disease dominant, it does not mean that the health does not persist. Health is there. Second, it is a story of the person as a whole that matters in a holistic sense rather than the illness focus of the medical approach. See, these all are published literature. These are all concepts which is being discussed in on a larger goal. Unfortunately, what has happened of late is like we have deviated from the philosophy and we just take the reductionist components of medicine. Medicine includes philosophy. So it is about the continuum of the health. It includes illness as well and the story of the person. The salutogenesis, the second concept, the story of the person is very, very important than the illness focus of medical approach. The third one is the health promoting factors. What are the health promoting factors and the opportunities for the person to improve the health promoting factors? When the whole world is worried about pandemic, how you can be solace, how you can be strong, how you can take a decision that you will not immunize yourself, how you can take a decision that germs do not cause disease. This is based on the health promoting factors around you, how my belief system is built on. I, being a researcher, I don't go with emotions. Like when I do not vaccinate my kid or I have not vaccinated for my COVID-19, It is not an emotional decision because I am in so much love with my system, nothing like that. I'm a researcher too. I don't look into papers which a single author says that this is the reason for that. I look for epidemiological observations. I look with common sense into things. When the infectious disease can come through the mask, or infectious disease can go from your sanitizer, why we are picking up the notes, going to the ATM, using all those things, bringing vegetables, how much of germs might have come inside our home? Whether we sanitize all the things, we lost our common sense. So it is more of the health promoting factors which need to be given the center of attention rather than the pathogens or the risk factors. Elevated cholesterol, elevated blood pressure, higher BMI, it is not a risk factor at all. The risk factor is whether the person is having the health promoting factors within him or not, or around him or not. And you are one of the health promoting factor, each one of you. Fourth, the tension and strain are potentially health promoting rather than a ubiquitous evil to fight. We always fight with our disease. We are fighting COVID-19, we are fighting diabetes, we are fighting hypertension, fighting stroke. On what we are fighting? We are fighting with our own body. That is why we are all getting autoimmunity, autoimmune disorders. Sometimes the strain, tension, the kind of things which you are getting is going to be productive, which is going to create a kind of an environment for the body to react. Fifth, active adaptation is the ideal in treatment instead of assuming right treatment based on right diagnosis. Right treatment and right diagnosis is a bullshit. And I'm very sure that there are experienced physicians along with me. 10 diabetes patients you take, you diagnose them as diabetic and you are given the same treatment which you are given for everyone. Has every 10 patients reacted in the same way? Are you very successful 100% for all those 10 patients? You're not. None of the physicians are 100% successful. And success rate is not determined by you giving the relief. So I have seen the same example of PCOS. If I take, I have seen in ultrasonography, PCOS is there. After 1 month of my treatment, no PCOS is there. Is the treatment ending there? Does your role ends there? It is not. So it is about ideal adaptation. Active adaptation to the environment where you are in is very, very important than assuming right treatment for right diagnosis. So our prescription making should always have these kind of factors in our brain while we are going for making prescription making. So when we make naturopathy treatment protocols, the treatment protocols are based on the need of the individual patients concerning their root cause, and the root cause is different. I have already shown you in the last slides the kind of factors, psychological, lifestyle, other factors which you need to understand for the root cause. Root cause is not what is said in your textbooks. Root cause is not determined. Nobody can determine the root cause, because for you, for me, for anyone in this particular group, root cause is going to be different. And the way you react to that root cause is what is so-called disease. And each treatment protocol should be designed after taking into consideration the stage of the disease, the toxemia stage and the vitality stage, which I have explained some 30 minutes back. It is not necessary to intervene the patients always with external treatments. When I got COVID-19 back in 2019, towards the end of 2020 or starting of 2019, I don't remember. So I did not took any treatment for initial days. I had the anosmia, I had all those symptoms which is there, but I'm very convicted that it is a phase which my body is going through. I got my sun exposure. There was no appetite, so I was not eating. So I was improving my vitality. I was meditating. I was doing all those things, and I was meditating on that whatever good factors can build in on. And I was never worried about that infection. Similarly, many people have that way in that. So there is one more experience which is shared by someone. It is very difficult, as my father is in the army, so I have to take vaccine. Although I make him understand that it's not good. I should discuss this separately. Even I have a vaccination certificate. You should get it what I meant by. Okay. Because the number of people now are more than who are pro for vaccine, and it is a government policy. And I shouldn't be discussing this over here. We will be discussing on a personal chat or something which is very specific to vaccine. Okay. So now moving ahead. What I was telling is, like, many times it is not necessary to intervene. We need to allow the patient to recover all by himself, and you will not lose money. You will not lose your consultation money. Even you speaking to the patient is a therapy. You can charge for that. Okay, so don't think that this is where somewhere we are, our role is not. Our role is definitely there. We are having a larger role than what the role we are playing, because as most of you told, it is difficult. It is not easy the way we are doing. The doctor prefix we carry in front of our name is really a honor. It is very difficult to carry that. It is not that easy what you are doing right now. And the stages of treatment planning is like, you will have a modern medical diagnosis which is coming in front of you. Then you need to go for the iris diagnosis. And if it's a TCM practitioner, you can go for a pulse diagnosis. Iris is one of the very, very brilliant holistic diagnostic method. You cannot earn money like an MRI reference. That is why iris diagnosis is not considered. And we want names for what is being diagnosed. Iris cannot give this. That is why it is not satisfying. The level of knowledge we have, we ignore iris. Iris can give the stage of the disease. Iris can give the state of affair of your body's nutritional status, body's condition, the stage of inflammation, elimination, everything can be reflected by iris. And you need to definitely look into the iris. You will be fascinated by the thing. And you don't think that 10 days of treatment, there is no change in iris. So iris is pseudoscience. No, you will not see change for 10 days treatment, because you have not treated the root cause. How we will find the change? And same thing I told before also. Diabetes 7.712 HbA1c, but you are not seeing anything in your pancreas area or your intestines area or your digestion area, because your laboratory is showing it is 12. The body is not recognizing it yet. That is a problem. So you cannot force your body to react in a way you want it to be. Or you cannot force the body to be in a way that you imagine the body is. The body is not in the way we imagine. Assessment of the individual and the root cause for a condition. Then assessment of disease, toxemia, and vitality status. And then we set into the treatments. First one is expectation setting. When a patient is coming to you, do not put short-term goals or expectations. Inform them on the individual cause and also about the purpose of the treatments, why you are intervening. Introduce the treatments that aid elimination and priming the vitality. Any condition, irrespective of the condition, it is your ENT problem, your stomach problem, your eye problem, your knee problem, irrespective of that, all the 4 eliminatory channels need to be cleared. Even after living in a positive, people are getting disease. What is your opinion on this? Again, here, Dr. Tamil Selvi, the positive environment. What is mean by positive environment? It defines your positive is not my positive is not your positive. So this is a common perception. What is a positive environment according to us? Having good salary, having a beautiful wife, having BMW car, having good life insurances, no stress, having a good bank account balance, and everything is good, and having a vacation in Switzerland or Maldives every year. And you think that that person is very much having a positive environment. I can give an example. Take all the politicians from India. Those are the guys who are getting more heart attacks and getting. The AIMS is built for treating politicians because they want to get the topmost care for themselves, for their heart attacks, obesity, liver diseases. Who is more richer than or more powerful than a politician or a person in our country? So positive environment is defined as different for different person. So we need to identify. That is why don't try to make common generalized approach. Try to make individualistic approach. That is the ultimate aim of this masterclass. Don't try to make generalized. I am not here to give comprehensive protocol for you to follow. I'm here to make you understand that there is nothing called comprehensive protocol which is available for us to treat our patients. All we have is the concepts which you need to apply on our patients. Then once you eliminate, along with that, you can add supportive treatments. If there is pain, definitely you can give pain relief treatment, but that is a conservative measure to give immediate relief to that particular patient's suffering. But you need to make them understand there is going to be pain remaining in that particular patient until and unless the root cause is not affected. And cushioning the protocol, what you are planning with philosophically oriented yoga, acupuncture, and natural hygiene therapies. So this is what we will be basically doing in our people. And decide on continuity of interventions, what the people need to do. Do not set realistic goals, 30 days of fasting, be on raw diet. It's not going to work. Who is going to be on raw diet for 20 days, 25 days, 1 month, 1 year? Nobody is going to make realistic targets. reassessment of the patient periodically. I will say that there was one patient in NIN when I was there. So I told I was a famous acupuncturist, modern acupuncturist back then. I don't do a philosophical based acupuncture. So I used to follow all the evidence-based papers and try to prick my patients. That was what I was doing. So I had a patient, she was around 35-year-old when she came to me. They were trying for, I was there in Pune for around 10 years. They were trying for IVF, very desperately trying for IVF because of the family pressure, what they are in. So she tried for 10 years. She has gone through a lot during those 10 years. I was not oriented too much during my first 5-6 years where I was intervening her. Later, I started speaking all these things to her, and she also, both of them, husband and wife, they came to me and they delivered a twins after I came coming to Bhopal. They called me and informed, doctor, we got a twins and all. So now that lady, for everything related to that kids, the kids get constipation, the kids cries, the kids gets rashes, jaundice, not sleeping properly, vomiting. She don't call a pediatrician, she calls me. I'm no pediatrician, but I know the holistic principle of living, starting from the birth of a baby. And she's not following any antibiotics, no vaccine and things like that, just because she is changed by means of virtue of naturopathy, not because of me, by naturopathy. And from a smaller generation, we can make that change. A reassessment of the patient periodically. She texts from nowhere, doctor, my kid is doing this, what I should be doing. So parental anxiety is something which is related to more of creating disturbances to the kids. It is not the kids' problem. So that is another one story. Then expectation setting, what we'll do, we'll discuss about the context of disease and health, break the stigmas regarding diagnosis and normal values. If you can do this, and there are papers, there are enough number of papers which I can supply you. Tomorrow we'll be discussing a couple of papers probably. Breaking the stigmas and the normal values. Make the patient a part of your decision making. As of now, you're right, okay, hip bath. Doctor, cold is good or hot is good? Take cold. The patient is not the part of decision making. The patient takes that as a metformin. The patient takes that as a glimepiride. It is a substitute. We are not making a change. You are nowhere a different doctor. Inform the patient about his or her integral role in healing. The patient has 95% role in healing. It is not the doctors. Doctors just provide the environment for healing, the right tool for healing. Then we will be going for treatments eliminating all the major eliminatory organs like your lungs. That is why breathing is very important in all the cases. First, you will be correcting your lungs. That is the first primary area to attack. When you are in a panic mode, when you are in an irritative mode, the first thing to attack is your breathing. It is your emotional breathing which creates all the metabolic disorders. You need to bring the emotional breathing back to metabolic breathing. You just Google both emotional breathing and metabolic breathing. You'll understand the difference between both. All our patients who are having metabolic disorders do emotional breathing. We need to bring in the metabolic breathing back. That is including the abdominal muscles like sectional breathing, bringing down the number of breath rates from 20 to 16 to 12 or 10. Then all our treatments, whatever we were intending to give for elimination of different therapies. Elimination is also improving the gut microbiota. So elimination is not only enema. Elimination is also providing probiotics. Elimination is also providing natural remedies to improve the gut microbiota. Taking a sun exposure, having immersion bath to eliminate your stress, yogic kriyas and counseling to heal the different koshas and the kleshas. This is the primary aid of elimination therapy. Tomorrow we'll take one example of a disease and we will discuss about this. The second one is supportive therapy. So many of you have asked about what about our treatments? Definitely our treatments is going to play a role. They are just a supportive conservative measure to add on to your eliminative therapies, and eliminative therapies is the primary focus because naturopathy is always about toxemia, be it mental toxemia or physical toxemia or the environmental toxemia. Then the supportive treatments to be provided based on whatever properties we have learned conventionally, that is going to be supporting that particular patient. And finally, we go for a long-term sustainable approach, which is that patient going to take home. Naturopathy counseling based on hygiene. Orthopathy. What is orthopathy? Let me see how many of naturopaths give an answer for orthopathy. It is okay to give a wrong or right answer. There is no judgment over here. So orthopathy means the right disease. Okay, so some diseases are very much good for our body, like a common cold. And if you're not getting acute diseases, that is going to be a problem. So we need to make the patient understand there are things called right disease also. You don't have to aggressively treat your body. Then Arogya Raksha Panchatantras, which is the common simple tool which we need to give to all our patients. And how to change the perception of other person according to them, it may be right, and also it's possible to change the opinion of other person without the help of psychological support. Again, it is about how you are presenting yourself as a person, how you are presenting yourself as a doctor. So this will be starting changing. Like now I am saying this with a lot of confidence because I practice this every day. You are having lack of confidence because you do not practice it yet. Try and doing that. You will get your own experience. Don't go with my experience. Tomorrow you should come and take a masterclass for all of us, telling that this was my experience. This is how I approach my patient. So it is about individual experiences. What patient you are getting, how the patient is reacting to you, it is up to you. Why you are a doctor? To combat all those pressure and permutations and combinations what your patient is presenting to you. And the sustainable therapy is bringing back, it is Arogya Raksha Panchatantras. Don't create the panic for germs and disease. Germs do not cause disease. And then looking into the social environment of the particular person. How to treat injustice. Tomorrow we will discuss on that for sure, about injustice. What is that injustice I am telling to you? The social and the environmental determinants, it comes under that as well, the injustice part. Then the Ashtanga Yoga concepts, starting from your Yama, Niyamas, your Panchakoshas concepts, all these need to be implemented, and the patient has to know about these concepts. They need to understand this particular concept. It is not only you should be knowing, they should be knowing about this particular concept. And then you can make the treatment methods. The layer of treatment making is, the first line approach is treatment that aid elimination and priming the vitality. The next intermediate approach means, along with first line approach, you can also add supportive treatments which prime the healing forces within the body. And then finally, the primary change is going to happen in a particular patient when they become philosophically oriented to the yoga, acupuncture, or the natural hygiene therapies which they are undergoing. Until and unless they find it relative to themselves, that they are healing themselves, healing is not going to happen. You may get numbers coming down, the patient's quality of life is not going to improve. It may improve for 1 month, 2 months, but they are going to come back with the same kind of problems. Okay, so that's all we have for today. I hope you will be having a lot of doubts. So we have set a tone for how the treatment prescription making is to be given. Tomorrow, probably we may just go with a couple of examples of treatments, like for diseases per se, how we need to look scientifically into certain diseases, and how we can comprehend whatever we have discussed so far to find an answer for our diseases. Okay, so thank you so much for joining in today, and I look forward to meet you all tomorrow. And I'll be sharing today's recording like how I shared yesterday in your email ID. Please go through it. And tomorrow I'll be sharing your feedback form. Please do give your feedbacks so that it will help us to improve and bring you more valuable programs to you all. Thank you so much. Have a good night and have a nice weekend tomorrow.